You're watching Channel M today, and joining me now, Peter Mount, who is the chairman of the Central Manchester University Hospitals NHS Foundation Trust. Welcome to Channel M today.
Thanks, Andy. Good to meet you.
Heck of a title. Must be a right mouthful when you introduce yourself to people.
Well, it used to be longer. We had Manchester in the title twice at one stage.
But that it is at the moment. Let's establish then the hospitals that come under your remit. Which are they?
Yes, of course, the one you've heard so much about recently, the new Royal Manchester Children's Hospital, which, of course, has moved from Pendlebury and Booth Hall, the Manchester Royal Eye Hospital, the Manchester Royal Infirmary, the Dental Hospital and St Mary's.
So those five are one particular trust, because there are obviously a lot of hospitals in Greater Manchester, but they're all split into different trusts and all run by different organisations.
That's right.
And what brings you to the position of being the chair? Because you're not a medical man, so how have you ended up running these, or the chair of the trust that runs these hospitals?
I've been doing this now longer than anything else, because when I left my private sector role back in 1993, I was asked if I'd become chairman of Hope Hospital in Salford, a great hospital, and then after doing that for a few years, with the merger of the children's hospitals with MRI, Central Manchester, I was asked if I'd become chairman of the new combined trust.
But it's a business background that you have, essentially,
Very much so, yes, it is.
Because the budgets, just for 5 hospitals, never mind the rest of the country and the whole of the North West, for your 5 are eye-watering. How much money does it cost to run the children's hospital for a day?
Well, the children's, let me give you the whole lot, it's £2 million a day.
£2 million a day?
Yeah.
Just to run 5 hospitals.
That's right.
So if we then extrapolate that to include perhaps the whole of Greater Manchester, what's the NHS budget for the whole of Greater Manchester a day, roughly?
The North West is 11 billion, 11.5 billion.
A day?
No, a year.
Oh.
A year, not a day, a year. Oh, gosh.
I did think that's quite a lot of money. But these are huge sums of money, aren't they? So, I mean, when that is given to you by the government, or when the money arrives, and they say to you, here we are, you know, Central Manchester, do you then decide which of the hospitals gets what? How does it work?
Well, we react to demand, of course, because that's what we're required to do. If you're sick, you want to get to hospital. But it's the primary care trusts who basically decide the allocation of money. And it's a government formula that decides how much money comes to the North West or the South East, depending on the age of the population, the degree of illness.
Do we bid for it? Do we ask the government for money and say, please, that we're going to have more elderly patients in the next 2 or 3 years?
No, government statistics keep track of all these trends, the demographics, these unemployment figures, ageing population. And the formula tries to respond to that to make sure the money is distributed fairly where the greatest need is to get the greatest money. That's the theory. It works pretty well most of the time. Pretty well? Well, naturally, if you're on the civil end, you always think you could do a bit more. But
there's never enough money. No department has ever got enough money. The NHS could spend money, and rightly so, because we want people to be well and want them to be treated well. I suppose that you could always ask for more. There's been a lot of talk, Peter, about public finance and the dire straits in which it's in. And there's been worry, I would imagine, that NHS spending is going to be cut. Now, both sides of the political divide, the major party at least, have said, oh, no, we're going to prioritise the NHS. How do you see it?
Well, I'm not a politician, Andy, but when you consider the 350 billion of public sector spending, of which nearly a third is health, that's the GP world, the hospital world, mental health, everything else, it's hard to see how we and health can escape. Because if we didn't take our share of the pain, then it would mean that we'd even more damage to education, social work, social care, benefits and so on. And that was a serious part of our economy. So those of us doing jobs like mine are preparing for a significant reduction of our overall budgets.
So the trust, you, with your 5 hospitals, and I would imagine chairmen and women in similar positions around Greater Manchester, are you making contingency and thinking, I'm going to have to cut here and that's going to have to go?
We're trying to think of being cleverer than that. The way the health service has been working for many, many years isn't as joined up as it could be. We think there are ways of working better with the primary care, the GP world, the mental health world, the voluntary sector, local government, so that we have a more unified less silos in the system and spend our overall money rather better. Just driving the efficiency up, frankly. We're going to have to do it. Because
you are obviously clearly expecting these cuts, and so then the bottom line is, will patients suffer? That's the bottom line. Well, of course, naturally, in a job like mine, that is the objective. What's been great in the last 2 or 3 years is to see a real new focus in the health service brought about by Lord Darcy, to put a focus on quality and not just output times, waiting lists and that stuff. And it's been a real new initiative. Now, having got that going, the last thing trust boards want to do is see that slip, because we are really improving our health, the quality of our health services enormously. Once upon a time, you'd wait 18 months for getting into hospital.
Now it's 18 weeks maximum.
But is that a result of targets being imposed by governments that had to make the NHS generally pull its socks up?
Yes, it has. In my opinion, targets...
Because medical practitioners, doctors aren't fond of targets. No, they don't like it. You can't put a target on somebody getting better, they say.
If you're on the receiving end of a target, you don't like them, of course. None of us do. But the reality is that targets have actually made us all try harder, work smarter, more cleverly and more efficiently. They have made a big difference, yes.
So you would be an advocate of them continuing?
I think they can't go away.
And finally, the current administration, the Labour Party, have made great play of the massive investment they say they've made in the NHS in their time in power. Have you seen a difference in their time in power?
Yes, we have. A massive difference. Well, it was, 5.5% of gross national product. It's now 8.5%. There's been a bigger investment in health in the last 8 or 9 years than we've ever seen before. So it is a massive increase. More doctors, more nurses, more hospitals. I mean, a hospital like the new trust in Manchester, costing £500 million.
Would we have had the new children's hospital with the Tory government in power?
I think we would, yes.
We would have done?
Oh, yes.
So we've got that, because we're very proud of it. I've been there with my daughter on one very brief appointment that she had to conclude because she'd been at Pendlebury. It's a fabulous place. Has everybody settled in all right?
I think I would say yes. Of course, like any new... We haven't even moved in completely yet. We've got one hospital still to move, and that's the eye hospital, which starts next week. So we've moved St Mary's, we've moved Manchester Royal Infirmary, we've moved the Children's Hospital. So they're up and running. We're not moving the dental hospital, although we are moving some of it. So they're all settling in, and they're finding teething troubles, but by and large, staff are delighted with it.
I mean, it is a centre of excellence. I mean, children will come from all over the country. Will they come from Europe as well? Is this going to be an international base?
Who knows? But as a foundation trust, we now have a more commercial flavour, so we might even be... I'm thinking...
I mean, as a businessman who runs chairman of the trust, you're thinking, I've got some facility here I could, utilise financially, if nothing else.
Let's look after the children of the northwest of England first, and then if there's any spare space... Let's do it then. But our own kids come first. That's what matters. OK, well, good to have met you. Thank you for being so candid about how things are going to be. Let's hope you can find the efficiencies and the savings that are necessary so that patient care isn't compromised in any way. Peter, nice to have met you. Thanks, Andy.